At present, polymerase chain reaction (PCR) and antibody testing are the dominant ways that global healthcare systems are testing citizens for COVID-19. Both techniques have the caveats. And as the crisis unfolds, researchers are looking into alternative ways to screen for the deadly disease. Over the course of the current COVID-19 crisis, the importance of reliable, accessible testing to screen for the disease has become increasingly apparent. South Korea, where tests for the disease were made promptly and readily available when the outbreak first hit, has had a drastically lower death rate than counties which have responded less promptly. The majority of tests for COVID-19 can be divided into polymerase chain reaction (PCR) or serologic tests. Both of these tests use different kinds of samples to search for different hallmarks of the novel coronavirus, and neither of them are exactly perfect. What is PCR testing? At the moment, the majority of the current COVID-19 tests that all the reports are coming from are using PCR, says University of Sussex senior lecturer in microbiology Dr. Edward Wright. They detect the genetic information of the virus, the RNA. That's only possible if the virus is there and someone is actively infected. PCR tests are used to directly detect the presence of an antigen, rather than the presence of the body's immune response, or antibodies, by detecting viral RNA, which will be present in the body before antibodies form or symptoms of the disease are present. The tests can tell whether or not someone has the virus very early on. It's worth noting that PCR tests can be very labor-intensive, with several stages at which errors may occur between sampling and analysis. False negatives can occur up to 30% of the time with different PCR tests, meaning they're more useful for confirming the presence of an infection than giving a patient the all clear. It's not yet clear how long any immunity period after a COVID-19 infection will turn out to be. Historical studies have indicated that people who survived the 2003-2003 sudden acute respiratory syndrome (SARS) outbreak had antibodies in the blood for years after recovery. Both SARS and COVID-19 are caused by coronaviruses. But it's too early to say if COVID-19 will generate a similar immune response. Reports also indicate that some people have been infected with the virus twice over, meaning these particular patients didn't develop any immunity at all. All that said, if public health officials can get a handle on what proportion of the population are theoretically immune to the virus, the information could help lift the social distancing restrictions on movement. If there's a high enough level of people in the population who have immunity, they will then stop this virus from circulating within the population, which is known as herd immunity, says Wright. If someone is infected, as long as the people around them have immunity, the virus won't be able to spread. Unlike PCR tests, which commonly use swabs to detect COVID-19, blood samples are usually used for antibody tests. This is because there will be a very small amount of the coronavirus circulating in the blood compared to the respiratory tract, but a significant and measurable antibody presence. A COVID-19 antibody test, also known as a serology test, is a blood test that can detect if a person has antibodies to SARS-CoV, the virus that causes COVID-19. COVID-19 antibody tests can help identify people who may have been infected with the SARS-CoV virus or have recovered from the COVID-19 infection. At this time, researchers do not know whether the presence of antibodies means that you are immune to the coronavirus in the future, or if you are immune, how long it will last. Many antibody tests are currently in development or available for use to detect antibodies to SARS-CoV-2. An antibody test looks for the presence of antibodies, which are specific proteins made in response to infections. Antibodies are detected in the blood of people who are tested after infection. They show an immune response to the infection. Antibody test results are especially important for detecting previous infections in people who had few or no symptoms.